Good morning, everyone. Yeah, my name's Uruakpa John Chukwemeka. So I'm here to just give you a little brief on how a commodity on medicine is entrenched into the national medicine list in Nigeria. So let me start with a little background on the EDL in Nigeria. Next slide. Okay, good. The NDF EDL is a very important document in Nigeria healthcare delivery system. The document forms a very important, forms the fulcrum for the treatment of various medical conditions in Nigeria. The National Drug Formulary to Essential Drug Lists Review Committee is the statutory body under the Federal Ministry of Health and Social Welfare. The review committee was established by Decree 43 of 1989, now Act Cap 252, to develop and review from time to time the essential drug medicine list, the National Drug Formulary, and the Nigerian Standard Treatment Guideline. So it is backed up by a decree, by a law in the country, the review committee. So they have three functions. As earlier mentioned, one of the functions is to review the essential medicine list, as well as the National Drug Formulary and the Nigerian Standard Treatment Guideline. Since the publication of the first edition in 1989, the committee has continued to perform these statutory functions and has successfully reviewed the 8th edition, which will soon be published. And it is in this 8th edition that the MMS will appear, because we have already made the defense, and it has been approved by the board or the review committee. Okay. This is how the procedure is. An application letter is addressed, that is, the company or the statutory body sponsoring the commodity or the medicine will have to address an application letter to the Honorable Minister or the Coordinating Minister of Health and Social Welfare, attentioning the Director of Food and Drug Services Department. Because the review committee is under the supervision of this department. So when the application is made, the Honorable Minister, through the Permanent Secretary, will minute down the application to this department, and the department will in turn scrutinize the application to see if it is in line with the statutory requirement. And also ensure that some attachment, the necessary things required to meet up with the committee's standard is intact. So by the time this department ensures that the application is in tandem with the criteria that was set, they will now direct the application with the attached evidence to the review committee. So the review committee will now formally invite the organization or the statutory body that is sponsoring the enlisting of that document into the essential drug list for defense. And the body, this review committee, is made up of experienced professionals, especially in the pharmaceutical and the medical area. Most of them are professors, emeritus. Most of them are also have served in several of similar statutory body within their career. So they will invite the organization or the institution that is sponsoring the commodity or the medicine to be listed in the drug list for defense. In fact, it's always a very serious issue because you have to come with all your evidences and you have to come with your team to defend why that drug or commodity should make that list. So they usually sit for they usually sit for 2 or 3 days to make sure that the application is thoroughly given attention. Whereby there was no enough evidence, they will not approve it. You will be asked to return back next time, but within 6 months, with enough evidence for them to look at. But if at all you have a concrete evidence and your team was able to defend it properly why it should make up that list, they will issue a kind of temporary approval and then make their recommendation to the Honorable Minister of Health, who will now look at it and either finally approve it or not. So it's really a very serious stage because most times not all that comes is approved. You may have up to 20 people want to make their dog to make the list. Only one will be approved. Yes. So getting MMS into it was a Herculean task. It wasn't easy. So we are all there with most of the partners and a lot of evidences to prove. And in fact, what really helped us was that an AI was conducting a research in Bauchi State. I think Vitamin NGA was, all our partners were busy doing one thing or another, so they brought the evidence. Because they don't usually accept the evidence from other countries. They want, in the Nigerian context, what is the research evidence that this must be included? Because the essential drug list is meant for Nigerians. So this is the procedure that we have. The body does not, this is not an indefinite, the tenure is not indefinite. The chairman, they have the chairman, I think after every 5 years, the minister may deem it necessary to renew or ask the chairman to step aside, then a new person comes on board. But it's a very serious committee in Nigeria. So anybody coming to meet them, you must be very prepared. Make sure that your commodity is accepted. Otherwise, they'll throw it out. Thank you very much.